Salam. This is our playlist on top Pharm reactions, and today we are having a very interesting video for you, talking about colorful drug side effects. Let's go. A 28-year-old female delivered a child by spontaneous vaginal delivery. On initial evaluation, the baby is found to have lethargy, hypotension, gray-colored skin, and abdominal distension. The mother's vital measurements are found to be within normal limits. Upon further inquiry, it is revealed that the mother had been taking medication during the length of her pregnancy. Which of the following medications was the mother most likely taking? As always, we will give background information, so in the end of this video, you can easily answer the question. For the first disorder, what can you see right here? We have a pale-looking infant, and the color of his skin seems to be gray, described as ash-like. We can also notice that he is having lethargic eyes. So, what is your diagnosis? This is gray baby syndrome. It is commonly caused by the antibiotic chloramphenicol. And since it is associated with cardiorespiratory dysfunction, you should be aware that this is a fatal condition. So you need to start the management right away with resuscitation. Of course, chloramphenicol should be stopped from the mother, and in severe cases, you might even need to do an exchange transfusion to remove the drug from the infant blood. Now for the second condition, what do you see in this picture? So this is a young man. We can see his back. It is all dark red. Also, the patient described having pruritus or itchiness all around his body. This is red man syndrome. It is caused by the rapid infusion of IV vancomycin. So when we have a patient with MRSA infection, it is usually treated with IV vancomycin. Sometimes the physician might mistakenly give the IV vancomycin with rapid infusion rate. This can let the drug vancomycin go directly and cause degranulation of mast cells and histamine release, causing red man syndrome. And since the pathophysiology is mainly related to histamine, the best treatment we can offer are antihistamine drugs. For example, diphenhydramine. Alright, the next colorful side effect will be the famous red to orange body secretions caused by Rifampin, which is usually used in the treatment of TB. This is a well-tolerated side effect, but in licensing exams, this side effect is frequently asked because 1. It's unique for Rifampin, 2. Sometimes the patient might come and complain about having a bloody saliva, or he might complain of blood coming out when he urinates. But on inquiries, if the patient is taking Rifampin, it might be the main reason for this discoloration. Then you can reassure the patient that this is just a side effect from the drug and there are no real consequences for it. For the last two side effects in this video, we have blue man syndrome, which is basically a bluish discoloration of the sun exposed area. It is caused by the antiarrhythmic amiodarone. The next one is purple toes syndrome. And purple toes syndrome, as you can see, is just a purple toe. It is caused by the drug warfarin. Usually it happens to the elderly people who are taking warfarin along with multiple drugs. For both of these conditions, the management will be to stop the offending drug and to switch to other drugs in the same class if tolerated. Now for our fire summary. Gray baby syndrome is caused by chloramphenicol. Red man syndrome is caused by rapid infusion of IV vancomycin. The orange body secretions are seen with Rifampin. Blue man syndrome is caused by amiodarone. And lastly, purple toes syndrome is caused by warfarin. In the end, let's answer the intro question. A 28-year-old female delivered a child by spontaneous vaginal delivery. On initial evaluation, the baby is found to have lethargy, hypotension, gray-colored skin, and abdominal distension. The mother's vital measurements are found to be within normal limits. Upon further inquiry, it is revealed that the mother had been taking medication during the length of her pregnancy. Which of the following medication was the mother most likely taken? A. Warfarin, B. Vancomycin, C. Chloramphenicol, D. Lithium. Basically, this question is asking about the medication which caused this condition described in the scenario. So the first step will be to know the diagnosis. Now the positive findings in this case are inbred. The baby is found to have lethargy, hypotension, gray-colored skin, and abdominal distension. So as you can see, this is classic for gray baby syndrome. The next step, which drug can cause gray baby syndrome? And as we all know, it is chloramphenicol. So the answer will be C. Thank you for watching, and if you like this video, don't forget to hit the subscribe button and share the video with your friends. Until next time, salam.